In this episode of the Nurse Practitioner Podcast, Dr. Cameron Duncan discusses transcranial magnetic stimulation. Thanks so much for taking the time to chat with us today, Dr. Duncan.
Yeah, thanks for having me.
So first, what is transcranial magnetic stimulation?
So transcranial magnetic stimulation, I think, is one of the coolest treatment options that have come about in quite a long time. I'm a psychiatric mental health nurse practitioner, and I own a clinic in Reno, Nevada that's independently nurse practitioner owned and operated. And our focus is blending mental health with physical health. It's really important to me and my philosophy when it comes to health that you really can't disconnect physical and mental health from each other. We really need to think about the person as a whole. And that's the same thing is true when it comes to treatment options. Major depression is the most common mental health diagnosis that I see in my clinical practice and that we see really across the country. And on the most recent statistics that I've seen, approximately 7% of people in America will experience major depression at some time in their life. And treatment for depression, it can take a variety of shapes, but typically we use various psychiatric medications like antidepressants or mood stabilizers to help treat with depression. And then there's also many types of psychotherapy or talk therapy that can be really effective in treating depression. Both of those treatment options are very effective. Their efficacy is strong and they are very safe and reliable treatment options. But there are patients who unfortunately don't respond to those typical treatments like therapy or medications, or perhaps they have untoward side effects to medications. And when that happens, us as mental health care providers, we have to figure out different options for them to help them in battling their depression. So that's exactly where TMS came about. Transcranial magnetic stimulation, or TMS, as I'll probably refer to it a few times today. It's a treatment option. It's non-pharmacologic, so patients don't have to take medication with it, but we'll talk about that a little bit more. But it's a treatment option that uses magnetic pool, hence the name, to target depressive symptoms in the brain. The method that TMS uses is called neuromodulation. And neuromodulation means, if you think of it simply, it's how to modulate and how to activate certain areas of the brain that may be responsible for the depression symptoms. What we know about depression is that there are decreased activity. So those neurons in your brain are not firing as they should be, specifically in the dorsolateral prefrontal cortex. So what we try to do at TMS is we use the neuromodulation directly over the PFC, the prefrontal cortex, to try to activate those neurons and get them firing and activate that area of the brain, hopefully with the end goal of relieving many, if not all, of those symptoms of depression.
All right. Thanks so much for explaining TMS for us.
Yeah, if I can add one more thing about it, just so our listeners can really understand what TMS is. TMS is a machine. And the main part of the machine, we refer to it as a coil, but what that is it's a magnet that is housed there. And when that magnet is activated, what it does is it depolarizes those neurons in the brain to get them firing. A single treatment of TMS will pulse over 3,000 times over the treatment course. So it's really a quite fast treatment option, but the coil just sits right on top of the scalp. And when it pulses, it might provide a little bit of discomfort, but it doesn't cause any pain to the patient who's receiving the treatment, which is one of the great reasons why I really like this treatment option. The second thing is patients can tolerate it very well and not have to risk having side effects from this treatment like they do with medications. So even though medications are really effective and they're still our first line treatment for treating depression, TMS is really a much safer option.
Thanks for breaking down TMS.
Yeah, absolutely.
What patient characteristics must be present to be a TMS candidate?
So as of right now, TMS has been cleared by the FDA for treatment in adults who have treatment-resistant depression. And treatment-resistant depression, what that means is that you have tried and failed another type of treatment, like one medication, or you've done some psychotherapy for some time, whether that's cognitive behavioral therapy or EMDR therapy, whatever the case might be. When you've tried and failed just one of those options, that's when you're considered to have treatment-resistant depression. However, most patients, they don't actually access TMS treatment. And in some cases, insurance won't even allow TMS treatment until patients have failed 2, 3, 4, some insurance companies used to say 6 medications. So you can imagine the amount of time and the amount of struggle some patients might have when they're trying to seek help for their depression because they can't necessarily access the service. But TMS is approved by the FDA in that specific population, adults with treatment-resistant depression. And typically, those patients will be referred to a psychiatrist or a psychiatric nurse practitioner who will then perform that treatment. So what that means is primary care providers or even other specialists who have patients who are dealing with depression can offer and recommend TMS and get them referred to a behavioral health specialist. TMS is also, it's indicated in people with treatment-resistant depression, whether this is their first, what we call a single episode, or if it's a recurrent episode of depression. So some people, they have recurrent episodes throughout their lives where the depressive symptoms meet the criteria for major depression, and it comes at sometimes unpredictable periods throughout their life. Whereas other people maybe have only experienced just this single depression episode. Both of those patient populations would be eligible for treatment. I think I mentioned earlier, we don't use TMS therapy as a first-line treatment option. That's not how the FDA has approved it. However, TMS, as I said, because of its safety and its effectiveness, could definitely be used very, very early in treatment. And TMS now is really covered by most insurance companies, including Medicare and Medicaid in most states. So it's really important to know that all patients with health insurance have access to TMS therapy if it's in their region.
Well, here's hoping patients can have more of an ease of access to this treatment option.
Right. Access is such an issue with mental health as a whole. And I'm happy to see that there are more and more strategies getting put into place. There are more and more mental health providers getting out into the community and serving the community. And we still have a lot of work to do when it comes to the stigma of mental health, but I think we are moving in the right direction.
That's great to hear. Now, what is the treatment course for someone who receives TMS?
Okay, so prior to the first treatment with TMS, the patient will have an assessment with their mental health provider, whether that's a psychiatrist or a PsycNP. And they'll review the history with you about your treatment symptoms, how long the history, what medications have you tried, if you've tried medications, what types of therapies have you done, and kind of really assess exactly where you are now before they determine whether you're a good candidate for TMS treatment. But once the provider recommends the treatment, we can start the treatment right away. And it's a 36-day treatment course. So I'm going to help walk the viewers through this. Right at the first treatment day, that's when you meet with the TMS coordinator, who's the one who is really managing the machine and coordinates referrals and authorizations, perhaps, to get the treatment covered. You meet with them and you meet with your clinician at the same time. And what your team is going to do is get you comfortable in the chair for TMS. And the chair, it kind of reminds me of a dentist chair, just so you can get that perspective in your mind. I know not everyone likes going to the dentist, but at least the chair is pretty comfortable. And you get in the chair and your nurse practitioner or your psychiatrist will try to identify where your motor cortex is. And the reason we do that is because we need to transmit a single pulse at a time and cause movement on the contralateral side of the brain. So the coil is going to be on the left side right over your motor cortex, and I will press start and it'll pulse one time. And what we're looking for is a slight twitch or movement activation in your right hand on the opposite side. Once we find the minimum intensity needed to cause that movement, then I will slowly, again, pulsing one time at a time, move the coil up a half centimeter or down half centimeter until I can isolate movement in your thumb. Once I identify the movement in your thumb, then that means I know the intensity, and then I know the exact location where we're going to do treatment. So using the standard protocol, we move the coil forward a specific distance. So the coil is sitting right over that dorsolateral prefrontal cortex we talked about. At that point, that's when we can actually start the treatment. And each treatment session can last anywhere between 18 minutes and about 60 minutes or so. And that really depends on the intensity of the treatment based on that minimum intensity we just talked about. But it can also be lengthened based on the patient's tolerability. So what the patient's going to feel when the provider press start is the TMS machine is going to pulse 10 times per second. So it's really, really fast. And it'll pulse for a 4-second period. And it'll repeat that course throughout the treatment session until you get up to that 3,000 pulses each day. You continue that treatment for 36 total treatments, so 5 days a week, and that's about 6 weeks. And then the final 3 sessions, we taper them out. So that 7th week, you may only do 2 treatments, and the 8th week, 1 treatment to kind of slow down and end the treatment course. What we hope is, of course, sooner than treatment 36, but at least by that 36th treatment, the patient has experienced a significant or if not total reduction of their depression symptoms.
We appreciate you breaking down the logistics of the TMS treatment course. When TMS is effective, does that mean you can stop taking your antidepressants?
That's a really good question. And the answer will vary based on every single individual. What we hope, of course, is that when we use treatment options, whether they're medication, therapy, or this TMS therapy, that it helps the patient have a reduction and full resolution or remission of their symptoms. That would be ideal. And it is very possible with TMS. So I'm going to talk to you a little bit about my personal experience in treating patients with TMS. The majority of the patients that I've treated have been able to lower their medication. So some of them are on 3 or 4 antidepressant or mood stabilizing antipsychotic medications. And after the TMS treatment, we're able to safely reduce the medications without having their depression symptoms recur. I've had several patients too who have been able to taper down and discontinue all of their medications. And still to this day, they are doing very well in managing their depression. They're still in remission. But I've also had some patients who have a significant reduction of symptoms of depression. Their depression actually significantly reduces or even sometimes reaches remission. But when we try to lower the medication, those symptoms come back. So what we do in that patient population is we keep them on the medications that are keeping their depressive symptoms at bay. But at least now they're taking these antidepressant medications and not having depression. Whereas before the TMS treatment, they were taking 2, 3, 4 medications and participating in therapy and still suffering from depression. So it's kind of a mixed bag when it comes to what ability someone will have to decrease their medication or come off of medication, but there is certainly hope. And I would say the majority of people are able to reduce the amount of medication they're taking.
Thanks for sharing that distinction between patients and their responses to this treatment. Does insurance cover TMS?
Yes, insurance does cover TMS. I believe I mentioned a little bit earlier, both Medicare and Medicaid in most states does cover TMS. The majority of private payer insurance companies also cover TMS therapy. The caveat is each insurance company has their specific policy and criteria that a patient must meet in order for them to approve coverage of the TMS therapy. So For example, Medicare will approve TMS therapy for someone as long as they have treatment-resistant depression. So that means that they have failed at least one medication and participated in some form of therapy during this depressive episode. They have the most lenient policy in terms of someone being able to access TMS therapy. The state Medicaid programs, those vary state by state. I practice in Nevada, and Nevada follows the same guidelines as Medicare. So patients are able to get in the chair with that one medication and therapy treatment failure. However, there are some private payers that require a higher amount of medications to be trialed and used before they'll cover TMS. For example, one insurance company will cover TMS after 2 medication failures, and another private payer may not cover it unless you've had 2 medication failures when you've tried at least 2 medications at the same time, augmentation therapy. So each of them have different criteria, but I would say the vast majority of insurance companies across the country do pay for and cover TMS therapy.
Well, that's great news to hear. Now, what are the risks related to TMS? Are there any side effects?
Yeah, so this is, like I said, one of the reasons I really enjoy using TMS in my clinical practice. TMS is a relatively safe treatment option, especially when you compare it to pharmacotherapy. Medication therapy and these antidepressants that we use in treating major depressive disorder have multiple adverse reactions. They can cause weight gain and GI symptoms and sexual side effects, just to name a few. However, TMS has very few adverse reactions. The most commonly reported adverse reaction or side effect that happens with TMS is pain at the treatment site during treatment. So I mentioned to you earlier how quickly the TMS treatment pulses, 10 times per second. That pulsing can be very irritating on the skin or on the scalp, sometimes causing discomfort. It shouldn't be painful, but it could cause some discomfort and maybe even a slight headache from the treatment. That is the number one reported side effect to TMS treatment. However, I think it's really important to mention that even though it may cause that scalp pain or headache, those symptoms only occur during the treatment session itself. So as soon as that pulsing stops, that scalp pain, if you've experienced any, will go away. The other thing I'd like to say too is because you're coming in 5 days a week, over time, patients are able to tolerate the treatment more and more easily as their treatment sessions go on. The first time, and understandably, one might be a little bit nervous, one might be a little bit tense, and you're feeling that pulsing for the first time. But typically by that second or third treatment, you're walking in there confidently, you know what's going to happen during that treatment session, and patients report that tenderness that might happen with the pulsing does tend to resolve. There is a less than 1% risk of seizure that can happen with TMS therapy, but that has to do really with, two things. One, if someone has a prior history of seizures, of course, we want to avoid TMS and take extra precautions if delivering TMS to those patients while they are on their anticonvulsant medications. But as I mentioned, it's actually 0.1 to 0.5% of patients who do take TMS therapy actually have had a seizure. So it's very, very safe in terms of side effect profile and risk.
Overall, it sounds like that's a nominal side effect of this treatment option.
Absolutely. It's definitely a nominal side effect. And I just, again, want to mention, if you compare that to the side effect profile of antidepressant medications, where you have a likelihood of experiencing between 2 and around 15-16% likelihood of experiencing side effects, this is a much safer and more tolerable option.
Now, what is the effectiveness of TMS for major depressive disorder?
TMS is very effective. So I kind of want to go back a little bit and just paint the picture of someone who might come in for TMS. So this is specifically indicated for those patients, adult patients, who have what we call treatment-resistant depression. So that means that they've already trialed therapy and they've already trialed at least one medication before they're considered a candidate for TMS. Many patients have tried 3, 4, 5, or more even medications to try to resolve their symptoms of depression without effect. So all of these patients are suffering from depression, but I can speak for those patients who try more and more medications over time and aren't getting the reduction, how that affects the hope that they have that these symptoms are going to improve. However, TMS overall provides the majority of patients with a reduction of depression symptoms. So there's many scales that we can use to measure depressive symptoms. But the majority of patients, specifically approximately about 67% of patients who undergo TMS, have a reduction of symptoms. So improvement in mood, decreased feelings of guilt and anxiety, improved social and work activities and balance as a result of the TMS treatment. Approximately, I would say in between 35 and 40% of the patients in my office have actually reached remission, which means they're not having any depressive symptoms at all anymore.
Well, that's great to hear.
Yeah, and if I can add one more thing, what I also think is really impressive about TMS therapy is its long-term durability. We have studies that are looking at patients who undergo TMS therapy, have a reduction of symptom, and what we see is that their symptoms hold for the study I'm referring to now, hold for at least 12 months after treatment. So what that means is that you're not just getting a temporary improvement of your symptoms. This is something that is likely to be long-term and hopefully even permanent changes to your depressive symptoms.
Finally, are there other uses for TMS other than for major depressive disorder?
Yes, there are other uses for TMS. Right now, the FDA only approves treatment using TMS therapy specifically for treatment-resistant depression in major depressive disorder and for obsessive compulsive disorder. However, there are numerous studies in the literature that demonstrate the effectiveness of TMS on other diagnoses, including major depressive disorder in children, including depressive episodes in bipolar disorder, looking at various substance use disorders, including opioid and methamphetamine use disorders. There's studies out there that are looking at various types of treatment in the various forms of dementia. And there's even some studies that are looking at non-disease related symptoms like trouble concentrating or improved cognition. So there's a wide variety of, opportunity for TMS to be used more in clinical practice to help patients deal with whatever ailment or whatever symptom that they're dealing with at a particular time in their life.
Thanks so much for taking the time to chat with us today, Dr. Duncan.
Absolutely. I really appreciate you having me, and I'm happy to join you back again another time if you'll have me.
Absolutely. Thanks so much.
Thank you.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at the Nurse Practitioner Journal, and on Twitter at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks again for listening.